respiratory tract infection. Now, meanwhile, all the recurrent attacks of the cough are not fatal. We have to think. See, usually a childhood period, usually a toddler. So he experienced about 6 to 10 episodes of recurrent respiratory tract infection in the childhood period. Sometimes parents are very much worried. See, what I mean to say is about 6 to 10 episodes of recurrent respiratory tract infection in the total childhood period is quite normal. Okay, suppose if the family is too large and if the child is going to daycare center, to the school and all, so then such infections are quite common. We cannot avoid that. But recurrent infections are there, and if there is no signs of any chronicity, for example, child is not poor in gaining the weight, child is not having poor appetite, child is not poor growth potential, child is growing well, doing well, not dull child. In spite of recurrent respiratory infection, there is nothing to worry. So this has to be understood, and it should be convinced to the parents also, because many times parents are unnecessarily worried about this particular intention. As we know, there is before coming to the treatment principles, especially in terms of Ayurveda, so we need to understand certain important factors, and now let us discuss one by one. So far we have seen some of the basic things which has to be understood. So especially when are trying to give the treatment in Ayurveda. So as we know, the one of the major important thing is immunity. Okay. Now, for your understanding, I will explain these things. So we have got terms like upper respiratory tract infection, lower respiratory tract infections, and parenchymal disorder. See, when the infection starts from the nasal mucosa or respiratory mucosa, so usually when infection occurs in the nasal area or respiratory mucosa area, we will call it as upper respiratory tract infection. And in this upper respiratory tract infection, the major symptom will be always sneezing. Sometimes there may be nasanaha, that is nasal blockage will be there. These are the two important things. And from there the infection comes downwards and reaches the oral cavity area. As soon as it reaches the oral cavity area and touches the pharynx and larynx and all these area, so there will be cough. So what I mean to say is, when there is a cough, it suggests that an upper respiratory tract infection is get converted into lower respiratory tract infection. Okay. In the upper respiratory infection, you will have only sneezing, nasanaha, or nasal blockage, or sometimes you may have postnatal drip. Whereas in case of lower respiratory infection, postnatal drip will be there, and along with that, there will be cough, and there will be production of the sputum also. So these are the two important things which differentiate. When the infection further comes down from the lower respiratory tract into the trachea and bronchial area, then the same infection is called as either tracheitis or bronchitis. Okay. And now the infection comes down from trachea to the bronchus to the lung parenchyma. Then the disease is now converted into the disease of lung parenchyma. And in other words to say, common sense, we say that it is pneumonia. Okay? Because pneumonia where the lung parenchyma is involved. So this is how an upper respiratory tract infection, lower respiratory infection, then bronchitis, then pneumonia. Okay? This is how this proceeds. Now, an infection which is occurring in the upper respiratory tract not so easily gets spread into the disease of not so easily spread to lung parenchyma. It is not so easy phenomena. It takes a long time because God has given so many defense mechanisms in the respiratory tract. We have got defense mechanism in the form of mechanical defense, chemical defense, then cytotoxic defense, and then immunological defense. So for an infection, it is not so easy to come down and get into the lung parenchyma so easily because these defense mechanisms will not allow. But this is true in case of adults. In adults, all the defense mechanism is very intact and they will prevent an upper respiratory tract infection usually gets subside when it comes to lower respiratory tract infection, lower respiratory tract area. It gets subside, its potentiality will come down because the immunity works well, provided the person has got good immunity. But this is not true in case of children. What I mean to say, Asampurna virya, that is, children are having very less immunity. All the four immunity which I told, like mechanical, chemical, cytotoxic, immunological, alveolar, macrophages, and all these things, so they are not well developed in case of children. The integrity of this immune system is not so good. So, a disease which starts from the upper respiratory tract within no time can reach to the lung parenchyma. This is very important. This is how children develop pneumonia so easily. The reason why the children develop pneumonia so easily, because the infection will not take much time to pass through, because there is nobody to prevent. The immune system itself is very weak, or it is not integrated. Okay, but the same is not true in case of adults, because everything is fine and intact, and immune system is well balanced and well developed. So this is one case. Therefore, see, sometimes what happens, you can see those babies who are having DNS. Okay, children who are having DNS or nasal blockage and all, sometimes they used to be the more mouth breathers. They take the breathing through the mouth instead of nose. So they have direct attack of infection to the oral cavity. Sometimes upper respiratory infection never takes place. Directly there will be lower respiratory infection, and the child develops a cough and irritation. Okay, there is no sneezing, nothing. So this is quite common in those babies those children who are having DNS, because they are compulsorily, they become mouth breathers. Okay, so therefore I told in the beginning, where there is congenital abnormalities like DNS etc. is there, chance of respiratory infection is always more. Anyway, so immunity is very less. So when immunity is less, that itself is the problem. Suppose if the immunity is good, definitely there will not be any passing of infection, or it will be checked in between at any stage, either in the upper respiratory stage, lower respiratory stage, or in the bronchial stage, or in the parenchymal stage. It will not go to the parenchymal level, but it goes in children, especially in immunocompromised children. Therefore, whenever you are treating children with CASA, one drug should be always there in your list or in your prescription, which takes care of body immunity. This is the first prescription in case of CASA in children. What is that? You should have one immunomodulator drug which effectively combats the infection and increase the body immunity. Now, same thing has been told in our sense also. In our sense, what it is told as Pratishayat Kasaha Kasat Rajayakshmaha. Okay, see, upper respiratory infection, that is Pratishaya, that is converted into Kasa, that is lower respiratory infection. If the Kasa is not treated, then it leads to the lung parenchymal disorder, like pneumonia, or maybe tuberculosis, bronchiectasis, whatever may be when it runs in a chronic course. So same is told by Charaka also very clearly. Pratishayat Kasaha Kasat Rajayakshma. Okay, this is nothing but descending of the infection. So to prevent this, we should have one very To prevent this, we should have one very good immunomodulatory drug. Okay, now let us come. What is the drug of choice when you see immunomodulatory drugs? You have got so many immunomodulatory drugs. Now, when we talk about newborns, in the newborns, which is the best immunomodulator, so breast milk itself is a very good immunomodulator, because we know that those babies which are fed with the immunomodulator, that means babies fed with the breast milk, they have got very less incidence of respiratory tract infection. Okay, therefore, baby should be given with the exclusive breastfeeding.